Namaskaram, welcome. COVID-19 is spreading all over the world. The only way to prevent is to break the chain of spread by strictly adhering to rules of quarantine and reverse quarantine, as there is no vaccine or specific medicine against the COVID-19 virus. Just remember the basic principle of public community health. Prevention is always better than treatment. Today we will start session on quarantine and reverse quarantine. Before starting, this episode is a tribute to the mothers and fathers who have lost their lives due to COVID-19 all over the world. This should not happen. We need to prevent this. These are all preventable. So please hear the beautiful music very carefully and offer our prayers to them. Similarly, we have lost children also due to COVID-19 all over the world. This should not happen. We need to prevent this. The following music is a tribute to them. Please pray for them. What is the dynamics of COVID aerosol? Before that, we should know what is an aerosol. Aerosols are small liquid and or solid particles dispersed in a gas medium such as air. Their diameters roughly ranges between 0.002 micrometers and 100 micrometers. They can be directly emitted into the atmosphere. These are called primary aerosols like dust and infective organisms. Aerosols can be formed in the atmosphere by condensation. These are called secondary aerosols like sulfates. So we see the dynamics of COVID-19 virus. The tiny size of the aerosol particles of COVID-19 virus makes it easy for them to be inhaled directly into the lungs of other people present nearby. This is the likely mechanism by which COVID-19 super spreading, with attack rates as high as 50% to 75%. Being a new virus, the lack of prior immunity allows the infection to literally spread through entire community. What are the steps to be followed under reverse quarantine? Step number 1. Visitors must be minimized in places where vulnerable people are living. This includes limiting visits by relatives, neighbors, and socialites who come in contact with large numbers of people every day. Step number 2. Each family member needs to do their part to minimize the chance of bringing the virus into the house. Work from home option can help to limit exposure of younger family members to potential sources of infection. Step number 3. When there are vulnerable family members at home, the healthcare professionals working in the areas with high risk of infection should return home only after a period of self-quarantine. Step number 4. Children habitually close to their grandparents. It is very difficult to get children to follow all norms of social distancing and hygiene. They could easily act as carriers of the virus into the house without becoming sick themselves. Children may therefore be discouraged from mingling with kids from other houses till crisis is over. Step number 5. For designated caregiver, washing hands before and after providing physical assistance is an effective practical method. Step number 6. Split meal timing is another way to reduce aerosol spread during conversation over a meal. Social isolation of the elderly should be actively prevented. Use of mobile phones and other technology for the entertainment for relaxation of stress and anxiety. Hearing music of healing ragas can energize your stressed mind and make peaceful and happy. Step number 7. Keeping windows open will reduce risk of the virus circulating in closed spaces. Step number 8. For those who can afford a second home, the family could split temporarily, so that there is geographical separation between the healthy and the vulnerable. Step number 9. Treatment of chronic illnesses should not get neglected as a result of the family's attention being focused on COVID-19. Complications of such conditions can be difficult and expensive to treat. Telemedicine could be used instead of routine doctor visits to minimize trip to hospital. Step number 10. Through administrative and engineering modifications, hospital must try to keep elderly patients with chronic illness far away from the section that treat fever and respiratory illnesses. How successful is reverse quarantine? When COVID-19 will end? The answers to these questions we'll get in the next part of this session. For today we'll stop here. But for ending, just listen to the beautiful music for relaxation, peace and happiness. Why we are anxious and afraid? We will be anxious and afraid when we don't know anything. Anxiety leads to fear, which increases our anxiety. This is a vicious cycle without any end. So our aim is to prepare people to face the stressful situations without any fear and anxiety, and to manage it confidently without any stress. Individually we all are helpless. But as a team player you can complement each other and wonders will happen. So what is the full form of team? It is total effort by all members. As a disciplined citizen you all should strictly obey all the rules of pandemic prevention. Let us all say confidently that we will do it. Thank you my brothers and sisters. Hope you all enjoyed this session on quarantine and reverse quarantine. If you benefited from this channel, in gaining knowledge on community public health, please subscribe to this channel and give a forceful press on bell button. Third part of this session in the next episode. Thank you all. Valor Nanni. Valor Nanni. Thanks.